Hello again, everyone. I'm Dennis McCarthy with Upper Allegheny Health System, your host for Inside Olean General Hospital, a news and information program about Olean General, some of the programs, activities, and events that affect our lives. With us today is Tim Finan, President and CEO of Upper Allegheny Health System and Olean General Hospital. And we'd like to talk to Tim today about a very, very exciting program in cardiology that's coming to this region very, very soon, which will make a big difference in the way our lives are affected here. Tim, could you talk to us a little bit about the new cardiac program at Olean General?
Sure, Dennis. You're referring to our interventional cardiac catheterization laboratory that'll be opening in a little more than a month, around the middle of July. And this is going to allow Olean General Hospital the ability and capability to provide cardiac catheterizations for patients experiencing cardiac difficulties, and specifically to from an interventional standpoint, it will allow us to do angioplasties and to place stents to treat and respond to these cardiac issues. We're excited to be doing this program, operating this program in conjunction with Kaleida Health, upstate New York's largest provider of cardiac services. In fact, Kaleida has disassembled one of their labs, cardiac cath labs in Buffalo, and reassembled it here, and it will be a jointly operated program. I think what is significant about this program is that currently over 1,700 cardiac catheterizations leave Olean General's service area every year for either Buffalo or Rochester. And now we'll have this capability right here in town, 24/7, 365. So if there's a need in the middle of the morning, 2 in the morning, in the dead of winter, rather than have to go 2 hours on a snowy road, there'll be the capability to perform these procedures here. And undoubtedly, unquestionably, the availability of this program at Olean General Hospital will save lives. Again, the good news is that this program is being operated in conjunction with Kaleida Health. And I can't emphasize the significance of that collaborative effort enough. Kaleida Health is upstate New York's largest provider of cardiac services. They bring tremendous expertise to this partnership. And so we're very confident that this is going to really be a very, very significant program. Kaleida Health has hired 2 full-time interventional cardiologists to work at the lab here in Olean so that we will have this capability available 24/7, 365, any time of the day or night, any time of the year. Interestingly, 10 of our nurses and 2 of our radiology techs have spent 16 weeks in the cardiac cath labs and Kaleida training, so they're ready to go. And again, we think that this is going to be a very, very important program, and again, it will save lives because time is muscle. And the quicker patients receive interventions when they have chest pain or when there are significant cardiac issues, the better off they're going to be. And again, having this capability here in town is very, very significant.
It's quite an addition to an already pretty robust cardiac program at the hospital, including the chest pain center. But I think it's interesting because what I understand is these programs are very, very rare in New York in terms of getting new ones, a cardiac cath program in the state. It wasn't easy to get.
No, this has been a 2-3 year process, and I think Olean General's program will be the first new interventional cardiac catheterization lab to open in New York State in years. I can't give you specifics, but it's a very, very difficult service to get underway. There are a lot of regulatory approvals, a lot of regulatory oversight that comes into play. But again, the ability to do this in collaboration with Kaleida Health is very significant.
So the really good news for folks in the region here is that you're not going to have to go 2 hours to get great care, to get interventions. You can come right here in town.
Well, yeah, and I think that the issue of access, in and of itself, improved access, is going to save lives. It's going to save lives, and that's what's so wonderful about this program. If you rank order the 62 counties in New York State in terms of incidence of cardiovascular disease, Cattaraugus County, unfortunately, is very low on the list or high on the list, depending on not good. And so this is going to improve access. And there's a huge prevention and outreach component of these interventional labs that the state expects of us. And so in addition to kind of dealing with the onset of acute phases of disease here, we will be out in the community working with folks to talk about prevention and how to stay healthy. And that's exciting.
And it does seem that the region here and all the regions, people do need to live healthier lives with the incidence of mortality and even diabetes and those sorts of things. So that's great news that not only are we going to have a program here, but also an educational component and hopefully getting to the idea that people will be healthier and not have to get to the hospital.
Absolutely.
Well, thank you, Tim. Appreciate you coming by to tell us that news. We'll be back in a few minutes with our next guest. And welcome back. In the second part of our program, we're going to talk about falls and fall prevention, a problem especially for older people in our community. And with us for this part of our program is Sandy McFarland, who is the Director of Rehabilitation Services for Upper Allegheny Health System. And welcome. Explain first what Rehabilitation Services is and what parts of the area that covers.
Rehabilitation Services includes occupational therapy, physical therapy, and speech therapy.
Okay, quite a wide range.
Yes, it is.
A lot of people doing a lot of good work. Falls in older people, it's a problem, and it's a dangerous problem in many, many cases. How big a problem is it?
Well, actually, falls is a very large problem. About 1/3 of older adults over the age of 65 fall every year. Many of them have injuries, and many of those injuries include fractured hips. About 95% of all fractured hips are a result of falls. And many people, older adults who fall, often don't tell their family or tell their physicians that they fall. And one of the reasons that they don't tell their family or don't tell their physician or healthcare provider that they fall is that they're afraid that if they actually admit to a fall or tell somebody that they fall, and that they'll be taken out of that independent living situation. Right. They're afraid if they tell somebody they won't be able to live home any longer, that they'll be put in a nursing home. So there's that fear of not being able to live independently any longer.
So instead of trying to get some help or get some assistance with the problem, they hide it.
Right, and many times they're responding with things like, well, I didn't hurt myself, there wasn't an injury, so I don't need to tell anybody that I fell, rather than really helping in finding out what caused the fall or looking for a solution to why they fell. And we look at also, if somebody has fallen 2 or more times in a year, those people are what we call recurrent fallers. So those are more prevalent to falling, and they really need to find what's causing the fall, because there's really many different reasons why people fall. There might be different reasons that you would fall compared to different reasons that why I'm falling. Right. And so you need to really have your physician or a healthcare provider really assess those reasons and find out why you're falling and actually help to correct that.
So it's not necessarily aging that just causes people to fall. That's not it by itself.
No, actually many people think that aging, that falls are a normal part of aging, and that is not true. Falls are not a normal part of aging. If you're falling, or if you've fallen, that there's a reason for falling. So you really need to assess that and really find out what's happening and what's causing you to fall.
Okay. There's a lot of causes for people.
There's many different types of reasons for falling. There's what we call intrinsic causes, and then there's extrinsic causes. Intrinsics are those inside of you, and that may be, for example, lower extremity weakness. It may be low blood pressure. Okay. It might be hypotension, is the low blood pressure. It might be a variety of different things: dizziness, unsteadiness, gait imbalance. All of those things are something that inside of you that you're having a problem with. Also, things such as difficulty with sensation in your feet. A lot of people who are diabetic have lost the sensation in their feet. Right. And if you think about it, if you can't feel your feet, how easy is it to fall?
How are you going to know?
So those are some of the things that we look for. And all of those things can increase your risk for falling. Then there's also what we call the extrinsic factors. And those are other things that we look at. For example, unsteady sidewalks, uneven sidewalks. Also things like your own home. Is your home cluttered? Right. In Western New York, we also look at the weather conditions. So are the snowy sidewalks. Things like your stairs, trips in carpeting, uneven carpeting, lighting in areas like the lighting in a room.
Pets?
Pets, yeah,
Okay.
pets are definitely. We have a lot of falls from people who trip over pets and things like that. So those are all extrinsic factors that may cause somebody to fall.
There's a lot of things that are going on here.
Right.
It could be going on in someone's life. So how do they look at that and say, gee, I am having a little trouble? What can they do about it? How do they approach this whole thing? You mentioned that some of these things are beyond their control, like sidewalks and
Right.
places in the weather. But what can they do to take, take some control here, or try to make a move that's going to help them?
Well, the first thing that they need to do is, first of all, start talking about falls. One of the other factors or risk factors for falls is a fear of falling. If you're afraid of falling, then that does increase your risk for falls. And the first thing to do is to start talking to people about falls, and your healthcare provider, talk with your physician about falls. One of the things that Olean General and I, through Olean General, have been working with is the Falls Prevention Program through Cattaraugus County Falls Prevention Coalition. And we've been working on a grant through the Community Health Foundation of Western and Central Pennsylvania. And one of the things that we've done through that is we offer actually to be able to do a home safety self-assessment,
Okay.
where if people would like us to come into their home and do a safety self-assessment to evaluate if there's any hazards within the home, and that's actually what this booklet is. We actually go out into the home and can evaluate and look at the risk factors in their home. For example, if they have throw rugs, if they have unsafe steps, if they don't have good lighting. And actually somebody can actually just easily call the Department of Aging, Cattaraugus County Department of Aging, and ask somebody to come out and do a home safety self-assessment, and we'll come out and help them with that.
So that's good news, and I know that adult children with elderly parents worry about their parents, and that's probably something that those folks could think about for their mom or their dad, and they're worried about it. Maybe mom or dad has fallen at some point, and then they don't know what to do. So that sounds like a great solution. They can get that through the health department.
They can get that through the health department. The other thing also is talking with your physician, and for example, asking your physician for a referral for physical therapy. All of the physical therapists at Olean General Hospital have been trained in falls prevention and can assess for those risk factors. For example, they can do standardized tests that determine lower extremity strength. They can determine if somebody has a gait disturbance. They can determine and do standardized tests to see what somebody's risks are, and actually help them to improve and limit their risk factors for falls.
So there's a lot that can be done. What can be done around the house? Things that people can do. You know, perhaps it's just some of it's common sense. Perhaps not everybody needs an assessment toolkit, but all of us are subject, perhaps, to taking a fall, and some of it's as much common sense as tripping over a cat in the night when you're trying to go downstairs and there's not enough light.
There's really some simple things that you can do. One of the biggest things that we recommend is that you get rid of throw rugs. Throw rugs are those rugs that you have in front of doorways, in front of chairs and things like that. The throw rugs are very easy to trip over. So either getting rid of those or tack them down with double-sided tape so that they cannot be kicked up and easily tripped over. Another really simple thing is a night light. Putting in night lights, especially in areas where you're going to the bathroom. Many older adults get up in the middle of the night to go to the bathroom.
Right.
So in hallways towards the bathroom, in dark areas, especially stairways and things like that, having night light that can light your way so that it's easier to find your way around. Other simple things is a grab bar in the bathroom near the toilet and near the shower so that you can easily get in and out of the bathtub, easily up and down from the toilet. So having a grab bar can greatly reduce your risk of falls and things like that.
So it sounds like a lot, some of it is pretty much common sense, but it's things that people take, railings, for instance, in the right places.
Railings in the right places, railings in and out of the house so that if you have stairs to get in and out of the steps in and out of the house, or steps up and down into the home. Up to the second floor, railings make a big difference and make it much easier to get up and down. Those are all simple things.
I think you mentioned we might be surprised. House sounds like a hazard zone, by the way. Listening to this, the things that are around anybody's house can be dangerous. But I think we were talking before. The most dangerous areas in the house that causes falls might surprise people.
One of the most dangerous areas is your living room. And one of the reasons that your living room is so dangerous is that's the area that we spend the majority of our time in, is because we spend so much time in there that it ends up being a very dangerous area. The other next most dangerous area is your bathroom. because it's often bathrooms are very small, and so there's limited space in there, and often because it may be very wet, because we have the shower and those areas. So those are often very dangerous areas for us. So.
Surprising. People might think, well, the kitchen, might
Yep.
be a very dangerous place. But it sounds like the pets are a problem. Always know where your pets are at all
Right.
times, because they're
Right.
generally where you don't suspect them, probably behind you, right behind your feet.
Right, and especially pets love to be close by when you're there, so you need to watch out for the pets.
There's some safety issues. I think keeping floors dry.
Keeping floors dry, making sure that you keep floors dry, make sure that you keep clutter, limit the amount of clutter that you have in the area. That's a big area that we see a lot of falls from, is clutter. Another area too that I hadn't mentioned was medication.
Yes.
Medication is a big area, and believe it or not, just the fact that you take 4 or more medications puts you at increased risk for falls. And people are surprised by that. There are some medications that put you at greater risk. Some types of medications, which are antidepressant medications or mood-altering medications, or medications that help you sleep. Those medications definitely will cause increased risk for falls. So what you really need to do is talk to your physician and your healthcare provider about your medications and know the risk factors for your medications. Make sure that you're not taking medications that are not necessary, and make sure that you're taking your medications correctly. Because a lot of times people are taking medications maybe they don't need to take, or when they've gone to the hospital, they've had their medications changed, they come back home, and they may not know how they're taking their medications any longer. So talk with your healthcare provider or your pharmacist about your medications to make sure that you're taking them correctly.
That's great information. Do we miss anything, Sandy?
The only other thing that I'd like to mention, 2 other things really, is vision is really important. I see you're taking your glasses on and off.
Yes, when I take them off, I can't. Well, that's a whole different set of problems.
Vision, making sure that you have your vision corrected is very important, because
Yes.
obviously if you can't see well, that does increase your risk for falls.
Sure.
So that's very important. And then of course, since I'm a therapist, exercise is probably one of the most important things for staying healthy and preventing your risk for falls. We really do encourage exercise. Because lower extremity weakness and weakness can increase your risk for falls. So being active and staying on your feet can really help you to
It
prevent
makes sense.
falls.
Strengthen the core, strengthen your muscles. Sometimes people find that, well, they're weak in the knees, and that can be a
Lower extremity weakness really does play a big part. And so what we really tell people is that, movement is life. The more that you stay active, the more that you stay up on your feet and stay active, the longer that you're going to, keep moving and prevent falls.
And again, one more time, if you'd like a free home assessment,
You just call the Department of Aging, Cattaraugus County Department of Aging, and they can do a home safety self-assessment.
that's great information. Thank
Okay.
you. Thank you for being with us.
Thank you very much.
That's all the time we have for today. For more information on falls prevention and rehab at Olean General Hospital, go to our website at www.ogh.org. Thank you for being with us. I'm Dennis McCarthy. Have a great day.